In our conversations with Yale New Haven Hospital, which is one of the major testing sites in the area, they were totally overwhelmed last week. And I think that's a combination of both a lot of people going on vacation and wanting to be proactive about keeping family members and friends that they might see safe, and the dramatic increase in the number of cases that we're seeing. A lot of breakthrough cases. Of course, the hospitalizations that we are seeing, the vast majority of them are people that are unvaccinated. I want to reiterate again, the most important thing people can do is get vaccinated and get boosted. The boosters, the increasing evidence shows, can dramatically help people in fighting Omicron. It is very easy to get boosted in New Haven, and there's a lot of information on the city's COVID website on where people can get the booster shots and get vaccinated as well. Today we're promoting a new testing site that has been in operation since, what is it, Monday?
Yeah, Monday.
Monday. In the morning it is here, in the afternoon it's on the green. I enjoyed the experience on Monday of putting my own saliva into the little tube. It took a little while to get up enough saliva to put it in the tube, but it is much less uncomfortable than sticking something up your nose. And it was fast, it was easy. Very grateful for the partnership with the state, Department of Public Health, and of course our emergency management team here and the health department for making this testing site more accessible. I'm going to hand it over to Director Bond to go over some of the details of the testing site and an update on COVID in New Haven. But before I do, I want to thank Alda Rodriguez, this is her ward, for hosting this site, and I'm going to hand it over to her to say a few words. Thanks.
Thank you. Thank you, Mayor Elger, and thank you, Director Bond, for the push on this site. So first of all, I'm not going to speak long. I'm going to have Director Bond, who's got a busy schedule today. I just want to thank everyone who's out here working. Prior to getting here, just a few minutes ago, I had 2 residents in the area that came through here and basically let me know that they were in line for about 30 minutes. By the time that the individuals that are handing the kits to them, everything was easy. So we're asking folks, like the mayor said, this is little bit less uncomfortable. This is less uncomfortable than the swab that everybody was nervous about. Please come out and get tested. Let's ensure everybody's safety. Let's continue to social distance, wash your hands, keep your mask on. And I'm going to put a message out there for all the restaurants and all the businesses. Take care of our community. Mask up, follow the guidelines that the health department is putting out there. You don't want to be on the chopping block that someone says you are not following the COVID protocols and you're harming our community. It is important to keep your businesses open, but it is also more important to keep the patrons of those areas coming, the patrons coming into your businesses to stay safe. Let's all follow the protocol, follow what Director Bond is issuing out there. We don't want you to get a visit. Follow the rules and stay safe.
Thank you so much, Alda Rodriguez. So clearly she's seeing some concerns in her neighborhood. She was ready for me to go out with her in the community and provide some education. So it's really critical, especially within her ward, to do that. All right, this microphone is funky. So of course, I wanted to just commend all of the partners that are here today. We could not make this possible unless we work collaboratively. And so this particular testing site is a testament of a partnership of the Department of Public Health, Wren Laboratory, our Emergency Operating Center, Rick Fontana, and the Health Department and many others who are working diligently to make sure that access to testing is not a barrier. Most importantly, we know that some people find it uncomfortable with the testing swab. So to be able to provide another avenue of saliva testing and being an additional city to offer this to our residents is something that is very commendable. I am excited that we are here in New Haven offering this. As you know, 2 local scientists from Yale University developed this test, and so now we have it here in New Haven. And as the mayor indicated, we are offering it here on Sergeant Drive and also making it commuter friendly right downtown in a central location where many commuters are often frequently and going through to get the buses and through the Connecticut Transit. So really excited to see that happening. As you know, we are highly concerned about Omicron. Omicron is highly contagious. We are seeing breakthrough cases. We are seeing an influx of hospital cases, and we are officially in high-risk transmission. And so we continue to ask our residents to get tested. Please try to limit any indoor gatherings that can pose a risk to others and yourself. We are knowing that currently the hospital cases that we have, 34% are breakthrough cases. If you have not had a booster dose, we have booster doses available to all of you. We have walk-ins right at the health department, and we have other partners like Griffin Hospital making it accessible on a Saturday and Sunday. So visit our website for more information. And with that, I'm going to turn it over to our Director of Wren Laboratories, Mark Kidd.
Thank you. Thank you. My name is Mark Kidd. I'm the laboratory director, and I'm one of those two scientists that was mentioned who helped develop the assay. We are very, very proud to be able to provide this to commuters, the City of New Haven, and to work with both the state, the city, Mayor Ellicott, everyone involved, and allow an assay that's easy to collect, easy to do, and easy to report. For us, the most important gift we think that you can give anyone right now is the gift of a negative test. We're all trying to stay positive, given Omicron and the variant going crazy, but if you can give someone the gift of a negative test, that's exactly what you need to do. Our assay is FDA EUA approved. We have 3 different EUAs for it. The FDA has approved the saliva collection process. As Mayor Ellicott indicated, it's easy to do, it's less invasive. You have part of your brain left over afterwards. The test is we can get the test rapidly done. We have staff working 12-hour shifts at the moment, both to make sure there are enough kits, as well as to ensure that you get your results in a timely fashion. We're open today, we're open on the green, and we're partnering with New Haven to continue testing right through the holiday season to make sure that people can stay safe. Thank you.
Good morning, everyone. We know certainly that the amount of COVID-19 fatigue right now is quite high. However, the current spread of highly infectious Omicron variant, holiday travel, and family gatherings make this a critical crossroad for this time of the pandemic. The Fairhaven Community Management Team applauds the City of New Haven and the State Department of Public Health, as well as Wren Laboratories, for making saliva testing available to our community. This is a convenient and less painful way of testing both for children and for adults. Confirming COVID infections could mean access to early treatment therapies and identify those with mild cases who are asymptomatic. This is particularly important if you're anticipating contact with people who are poor, have poor health outcomes, as well as the elderly. As a resident of Fairhaven, I'm pleased to add my voice to encourage people, whether vaccinated or not, to test before traveling and then 3 to 5 days after returning. Similarly, with gatherings, it's a good idea to test before and then 3 to 5 days later. As a dad, I'm very concerned about this. I have 2 children, ages 7 and 10. They're attending public school here in New Haven, and I'm so glad that as we travel now during the holiday season, that this test will be available. We will be taking full advantage of it. Thank you very much.
Can you identify yourself just so they know who you are?
Oh, my name is Lee Cruz. I'm a resident of Fairhaven and co-chair of the Fairhaven Community Management Team. Thank you.
All right.
You want to say anything?
Okay. So we're going to open it up for any questions.
I have a question. Sorry, I have a question for Mark with Wren Laboratories. Can you just step up to the podium a little bit and tell us about the demand for testing right now? Are you able to handle it? Is there enough production going on?
Yeah. Those are excellent questions, and as I pointed out earlier, we are working 12-hour shifts. We've recalibrated our manufacturing component And our intention is to be able to test everyone that needs a test. For sure, the reality is with supply chains, it's challenging. But our goal is to try and test everyone that needs a test and give them the report in a timely fashion.
Are they being developed overnight? How does this all happen?
Well, we had anticipated a certain level this week, and we were wrong. The demand has just exploded, particularly going towards the holidays. So we've had to recalibrate, and we're doing everything we can to make sure that the demand can be met. People are traveling, people are concerned about seeing people, and I think one of the things that we've really learned over the last year is how to deal with COVID, and one of the best ways of dealing with COVID is to test.
You can see a need for kind of an alternative type of testing that, some people did find, the standard testing uncomfortable. Did you feel like this was important to develop too, as the need for testing obviously continues, and making it kind of accessible to everyone?
You raise another very good point. A lot of people struggle with the nasopharyngeal approach. It's uncomfortable. There's also something called the Nares approach, where you swirl within your nostril. The one is uncomfortable. The second is maybe not as accurate as it could be. And one of the things that scientists at Yale and others have identified is that saliva is a very, very good reservoir for the virus. And of course, it's easy to collect. And most importantly, there's probably more virus in your saliva than in other areas like nasopharyngeal, especially when you have very low viral loads, when you're so-called asymptomatic, you don't have a lot of symptoms. So having a test that's very sensitive is incredibly important, especially with the variant exploding. And saliva is just a very good natural resource, easy to access and easy to collect and easy to test.
What's the percentage of, accuracy for this type of test?
So our test is more than 99.9% accurate, including the detection of the Omicron variant. So highly accurate.
Does this use PCR technology, or is it something different?
So there are a number of different approaches, and we do use PCR, and we use the gold standard, which is a two-step approach. We isolate the RNA, viral RNA from the saliva. We have a special stabilization buffer which actually kills the virus, so it makes it less, the sample itself less contaminated. That's a good thing. The second thing that the stabilization buffer does is it releases the RNA and stabilizes it, so we start that chemical reaction. We have tools to extract the RNA. We turn that RNA into something called cDNA, and then we do something called real-time or quantitative PCR, which is very, very accurate. And this is the kind of gold standard approach for detecting viral particles.
And it's not for anyone under 5, right? Is 5 the cutoff? If you're 5, you can do it?
Correct. So our FDA EUA approval is from 5 and upwards.
We get Director Bond up to the
Sure.
mic, please. Beyond testing, beyond, taking all these protocols of getting their vaccine, getting boosted, people are just nervous in general about the holidays right now. What are some other tips for people to maybe kind of keep in mind? I've gone and got my test, I'm boosted. What else can people be doing?
I think it's important for people to recognize that while we're in the holidays, to limit indoor gatherings if they're not part of the immediate household. Be mindful of those that are immunocompromised and their families or elderly because of the breakthrough cases that we are seeing. And so just to be patient, we are seeing that our cases here in the city of New Haven have increased 100% since last week. And so seeing that significant jump, we are anticipating that next week we're going to see an even higher percentage of cases. And so we want to ask our community to continue to safeguard against it, make sure you're social distancing. If you're in close proximity outdoors, you should be wearing a mask. And then again, if you're in your holiday spirit, we want you to be, but we want you to be mindful to be in the spirit with close family members and not extended family and friends at this juncture.
What can you tell us about those breakthrough cases? I know there's still a lot we don't know, obviously, at this point. Are a lot of them boosted as well? I know you said 34%.
So there's some preliminary data and there's mixed data coming back. When we were first getting the Omicron cases reported, they were not boosted, had only received the second dose and had been more than 6 months. But we are going to be closely looking at that as the data continues to come in.
How long is this site open? Is it just for the next week or is it longer?
So we'll be here for the duration of for the next month for sure, and we will assess the demand for and the need for the site to be open. And so we will be meeting weekly with the state to making sure that this site, along with the site downtown New Haven, is accessible as long as the community needs it.
And the 34% of breakthrough cases for that within Yale New Haven?
Those were hospitalized through the Yale New Haven hospital system within our county.
Are those people experiencing, obviously they're in the hospital, so they're serious symptoms, right? Or,
I'm sorry, I can't hear you.
I'm sorry, are those people experiencing serious symptoms? Obviously they're in the hospital.
Correct, and they're hospitalized. And so we are seeing an increase in ICUs within the county, and so we are concerned. As you know, the hospital did expand earlier last week, the emergency room, to be able to assist with COVID and non-COVID related matters.
What can you tell us about testing in general? It's not the only thing we should do to stay safe, right? Like, how long
Yeah.
people rely on testing?
So I think people should rely on testing because we know that people could be asymptomatic and be spreaders. And so testing is a great thing and an option for making sure that you are not having symptoms of COVID or having COVID. However, what's important is when you get tested. So if you had a direct exposure, it's important to get tested 3 to 5 days after the exposure, or if you become symptomatic for certain, prior to that. So we want to make sure that people understand when to get tested, because they can get a false negative. And so we want to make sure that people are getting tested at the appropriate times.
My last question here, and I forgot it actually.
It's all good.
No, I'm not.
Somebody go over just the specific times for
Oh,
each
yeah.
site, the hours, the days.
Yep,
for each site.
I will give you the schedule. So Monday, Tuesday, Wednesdays, we are here on Sergeant Drive from 8 a.m. to 12 noon. And then in the afternoon, Monday, Wednesday, Thursdays, on 250 Temple Street, 1 to 5. All good? Thank you.
Wait.
Oh, test participants.
Right here, it's right here. Let's redo that one.
Wait, Monday, Tuesday, Wednesday. Oh, wait.
Monday, Tuesday, Wednesday.
We just expanded our hours, so re-roll. All right. Sunday, Monday, Tuesday, Wednesday, Thursday, and Saturday, 60 Sergeant Drive from 8 a.m. to 12 noon. And then in the afternoons, Monday, Tuesday, Wednesday, Thursdays, 250 Temple Street from the New Haven Green, 2 p.m. to 7 p.m. And then Sunday and Saturday, 1 p.m. to 5 p.m. So we've actually expanded. Until further notice, we'll be assessing the demand as needed.
And vaccines are at the most now.
Yeah, and for the vaccination schedule, just visit our website. We are open 7 days a week at different locations.
Ms. Lamont, are you seeing an increase in vaccinations now that you guys are expanding the sites, like the one at the train station I saw you guys the last time?
So I think overall, the city of New Haven has steadily seen an increase each week. We're very proud of the community of having vaccination rates continue to rise. I don't think that there's one contributing factor over the other. I think because we're making it accessible at different times of the day, we continue to see an increase in the percentages. Not major jumps, but we have definitely been steady as far as an urban city. So we're very proud of that.
Thanks, everybody.
Thank you.